Mere days after announcing that 4 children were admitted to the COVID-19 intensive care unit at the Lillian Dahl Hospital, Minister of Health Dr. Frank Anthony on Tuesday reported that 3 of those children have had favorable prognoses and have been discharged from the ICU to the medical ward. He noted that overall there has been a slight decline in the number of persons who are hospitalized owing to COVID-19. At the moment, 13 adults and 1 child are said to be receiving critical care in the COVID-19 intensive care unit.
Those 61 that we have in the hospital, 3 are children, 2 are in the wards, so they're not in the ICU, they're in the wards. Their prognosis looks quite good, and we have 1 child right now that is in the ICU. So we continue to monitor these children to see how they're progressing, to make sure that they're getting all the meds that that is required, and all the other measures that should be taken are being taken.
On Friday last, Dr. Anthony confirmed that 1,567 children had contracted COVID-19 since the first case was identified locally on March 11, 2020. He did not disclose how many children are currently infected with the disease, but stated that majority of those who were infected belong to the 10 to 14 age group. In a statement on Sunday, health authorities indicated that among the total detected COVID-19 cases thus far, children represent approximately 7%. The increase in hospitalization of children with COVID-19 was described as worrying. It was further indicated that each of the children who were admitted to the COVID-19 intensive care unit had underlying comorbidities. None of the vaccines imported into Guyana for its immunization drive has been approved for children. Meanwhile, relative to COVID-19 vaccination, Dr. Anthony said that several other health centers in the capital city will be transformed to vaccination sites.
And we've had discussions with the municipality about making 3 of their sites into active vaccination sites. Last week we conducted a training for those persons who will be working there, and as of this week we want to activate that plan where health centers in and around the city would now become vaccination sites.
In addition, persons living with HIV can access COVID-19 vaccines at the National Care and Treatment Center located in Georgetown.
As of this week, we have been working with the National Care and Treatment site here in Georgetown to make that also into a vaccination site. So they should start from this week. So patients going there for their regular treatment, they would be counseled about taking the vaccine, and they can get the vaccine right there. And we're hoping to replicate this at all of our care and treatment sites so that these patients don't have to feel uncomfortable and go to one of the fixed sites.
Temika Rodney reporting for the HGP Nightly News.